Why? Why is there this effect? Well, the simple answer is that the S factor is so powerful and social relationships are so powerful because they impact us through multiple pathways, not just one. Okay? People provide us with practical assistance, everything from taking us to the doctor, loaning us money, providing recommendations. If you need a good doctor, dentist, you can go and ask somebody. Whereas if you're socially isolated, you don't have access to this kind of practical assistance. People give us support and encouragement. They push us, yes, you can do it, go, you can do it, rah, rah. Whereas if you're socially isolated, you don't have that. Connections with other people are a source of joy. They can also be a source of conflict. And that can affect our health. This gives us a sense of belonging. Emotion regulation, I think, is very interesting. We tend to think of ourselves as kind of these units, these individual units that walk around the earth, and we regulate our own emotions, and we do what we want, and this kind of thing. But the fact is that our emotions can be very, very much influenced by the people around us. How we feel is very, very much influenced by those around us. We're connected to other people, and our emotions are kind of hooked into other people to a very substantial degree. Social modeling, when we're around other people, they model behaviors, and that impacts our health. Our friends, the people that we associated with, they influence our health behaviors. Whether we go to the, if we have friends who go to the gym every few days, we're going to go to the gym, probably. If we have friends who tend to indulge in donuts and are very sedentary, we're going to indulge in donuts and be very sedentary. Also, conflict and stress. It's like there was a study done a few years ago that asked people, what is it that gives you the greatest joy? What kinds of experiences give you the greatest joy of all? And the answer was, experiences that are with other people, children, friends, And then they asked, okay, so what types of experiences give you the worst experience or the most horrid, relationships with other people? So they can be the source of both intense joy and intense conflict. Doesn't either way, it impacts your health. Okay, and I'm going to get into more some of the details of that. Okay, so through others caring, they make us care. Other people validate and embolden us so that we can fight with greater endurance. The wife, I sometimes say, Barack Obama, we see Barack Obama as being the president of the United States, and he's out in front, and he's fighting the fight. But behind him is his wife, who is saying, go Barack, go Barack. So it's that having that person behind you can make a difference. Social support makes problems seem less severe. You just go and you're facing a problem, a stress, you go talk to a friend or a parent or somebody, and very often just talking to them can kind of lessen the severity of the problem. Communications in the community can help us reintegrate when we get sick. If we're sick, we're in the hospital. If you're socially isolated, you're not going to have the connections to help you get back into the community and reintegrate. They influence the behavioral choices we make: food, activity, fitness, and so on, just like I mentioned. Knowing others need us compels us to take better care of ourselves. I myself have kids. Knowing that they need me maybe pushes me to take a little better care of myself than I might otherwise. Knowing that there are others to whom we can turn during rough times can reduce our level of stress. Working with others toward a common goal can be extremely rewarding, and having others with whom to share good times is a great source of pleasure. Just knowing that there's somebody else when something good happens. Like, for example, if you get a good grade on this paper or these exams, whatever these are sitting here, you might, for chances are, you might very well call somebody or tweet somebody or tweet or call or Facebook somebody or whatever, because you want to share. Not only the bad times, but the good times as well. Talking about Facebook. Facebook is amazing. It still blows my mind. There's more than 500 million active users. 1 out of every 14 persons on the planet Earth has a Facebook webpage. How many people here have a Facebook webpage? It blows my mind. Now, it's not just that people are signing up and establishing pages, they're actually using it, because the average user is connected to 80 community pages. The average user creates 90 pieces of content each month. I don't know where they find the time to do that. And it's interesting that 70%, about 70% of Facebook users are outside the United States. This isn't by no means an American phenomenon, North American phenomenon. It's a human phenomenon. This need to reach out and share. Oh, I went to this restaurant. It's great. I'm going. I'm visiting such and such a town now. Blah 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 blah. Yes, I'm finally over my cold. I feel much better now. Blah, blah, blah. And Twitter. Not going to go into the same thing. You know, we tweet and we Twitter all day long, and there's 55 million tweets per day. That must have an impact on productivity if you ask me. So I think that the need to interact, the need to reach out and share. You know, I just had this great experience. I just got this great score on my test. This girl that I love just agreed to marry me. Whatever. How many of you have heard of All in the Family? Okay, so I'm not. So All in the Family was a situation comedy in the 1970s. One of the greatest comedies of all time. So there were 2 characters in this particular little clip that I have here. This guy here, his name is Archie, and this guy here is Mike. Now, Mike, you can all appreciate this actually. Mike was waiting for his exams. He had taken some exams, and he was waiting to find out how well he had done. Okay, he was very, very nervous about this, and as a result of his stress and his anxiety about waiting for his grades, he had fights with his wife, and he wasn't talking with his wife. So here, as we open this clip here, the mail arrived, and he's waiting to see if he got the mail. So let's hope this works.
Occupant? No. Mr. Michael Stipp. Please. Hey, Yeezy. The grades here.
Oh, the grades came, Mike. How are they?
What's the story? Still in school or are you around?
Well, tell us, Mike.
They're good, 2 B's and an A.
Oh, that's wonderful. Don't you think so, Archie?
At least I'm overdone.
Gloria, listen to me. If a tree falls in the forest and no one hears it, does it make a sound? Look, I just got my grades, and I opened them up and I looked at them, and the fact that I got 2 B's and an A didn't mean anything to me. I mean, there they were, staring me in the face, 2 B's and an A, and without you there to share with me, I didn't experience it. I didn't feel anything. I got 2 B's and an A, didn't I?
Yes, Mike.
I did.
And now he feels it.
I got 2 B's and an A.
Oh, I'm so proud of you.
Oh, you see what I mean, Gloria? When you're not there to share something with me, I don't experience it. It's as if I don't exist without you.
Well, I feel the same way you.
See, something great happened to him, and though he was able to share it, he didn't really feel it. It didn't really impact him. And it was only once he was telling Gloria that you could see it in his face. He sort of. So, all right, now I'd like to turn to the science of the social factor. Now, as I mentioned earlier, this topic could really take a whole day. But I won't take the whole day. So what I've done is I've selected a few topics that I think are particularly interesting. One is I'm going to talk a little bit about what happens when people experience social support, that is, they have adequate social connectedness. Then I'm going to talk a little bit about what happens when people don't have adequate social connectedness. And then I'm going to talk a little bit about something that I call behavioral modeling, which is the effect that other people have on our own behaviors. and something called social pain, which Professor McDonald touched on. I'm going to delve into that a little bit. So, first thing I want to touch on is the effects of social support and the effects of social support on cardiovascular activity. Guerin, Piper, Levy, and Pickering took 40 undergrads and asked them to debate a controversial subject like abortion with 3 Confederates. 2 of the Confederates were very adversarial. They were arguing all the time with the participant. But for half of the participants, the 3rd Confederate was supportive. It was very validating. You know, oh, that's a good idea. Nodding up and down. And for the other half, the 3rd Confederate just sat there quietly. Okay? And in the meantime, while this was happening, blood pressure and heart rate was measured, and then following this debate, participants were asked about their level of stress, anxiety, and so on. Okay, so what happened? Well, each of these graphs here, each of these 3 graphs shows a different physiological measure. This one is heart rate, diastolic blood pressure, and systolic blood pressure. The difference between these 2 lines is significant in each effect. It's just that the effect is strongest for the systolic. The top line shows what happened in the case of no support. Okay, and oh, by the way, this is number of minutes into the discussion. So as the discussion proceeded, those people who had the 3rd Confederate just sat there quietly, their blood pressure just went up. It impacted them, you know, sitting there and having to debate with the 2 other people who were adversarial. But the group of participants who had that 3rd participant who would just like nod once in a while and say, yes, that's a good point, that buffered, it kept down their blood pressure. And you can see this effect happen also with the diastolic blood pressure and the heart rate. So just having, and by the way, this was a stranger, this was not a friend or anybody, a stranger who was supported, even minimally supported, made a big difference to the physiological reactivity. Now, you just imagine, this was in an experimental condition, you just imagine if this happens every day, repeatedly. People who don't feel that they're supported and that their support is not available to them might very well have greater reactivity. And as a result, if this happens chronically, it can lead to deleterious